With daily cases fast approaching 1,000, it's the first time in this pandemic that the majority of new infections are from the community and not from the migrant worker dormitories. Well, let's take a look at this week alone. The Health Ministry reported 534 new cases in the community on Monday. The number jumped to 755 on Tuesday. It continued to edge up to 770 on Wednesday, and it hit 803 yesterday. Professor Dale Fisher is here to weigh in. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Prof. So, given the rising daily case numbers in the community, we're likely to hit 1,000 very soon. Did you anticipate that Singapore would reach this mark so quickly?
Hi, Olivia. We certainly knew the case numbers would go up. We've been warning this for a long time, asking the population to actually understand that this is part of the process that we need to go through, and with so many people vaccinated, the vast majority will not get severe disease. It is Delta, so we know it's twice as transmissible as things we were dealing with last year. But yeah, I must admit I was a bit surprised. We really didn't ease much, actually, went to see these types of numbers. We really only allowed dining in small numbers, so it's not like we all took off our masks and we had large gatherings. It was, but I guess in that respect, it also tells us that all the measures that we did have in place were actually required when we were trying to contain the virus. So that's, I guess, useful information.
Right. I guess on the numbers front, Singapore has been here before. We have surpassed that 1,000 mark before, but that was confined to the dorms. So what's the strategy now, Prof, given that community transmission is less contained, shall we say, and should that strategy change?
Well, the strategy's changed. We're not trying to, I think in your sentence you said containing the community transmission, and we're not trying to contain it anymore. We're trying to contain it to a certain degree. We want to slow it. We don't know I think the Minister just went through the unknowns. We don't know how this is going to affect hospitals. We believe we have good insight from overseas experience and from modelling and from how it's been trending over the last couple of weeks, but we'd still like to go slowly while we learn exactly what that impact is. So last year and up until a month or 6 weeks ago, it was really about containment. Now we're in the transition phase to endemicity, which will be all about protecting the vulnerable, protecting those people in hospital and things like that.
Well, Prof, looking at the speed of infections, what are the numbers that we should keep an eye on before the wave peaks?
So there's no doubt, there's no dispute that it's a severe disease is what matters. Case numbers, we can expect those to go up. What we don't want to see go up is people in intensive care, people dying, obviously. And of course, this is going to be largely driven by the unvaccinated. We know our population's 5.7 million, so there's really 500,000 people eligible for the vaccine that still haven't taken it. And if and when those people get COVID, which they will with these large numbers, thousands in the country every day, then how much of an impact will they have? We know they have probably a 9 or 10 times greater chance of getting severe disease. So we just need to see how these numbers are going to impact on hospitals. So that's the one to watch. And if I could just say, look, if you're not vaccinated, please, it's not too late. It's never too late. Go and get vaccinated. Now what we've been warning had to happen as we eased restrictions is happening. The case numbers are going up, and the only way, the best way to protect yourself is to get vaccinated.
Yep, of course. Well, people, especially seniors, are being asked to reduce social activities for 2 weeks. Is restraint like this what it means to live with endemic COVID-19?
No, this is transition. I think we're transitioning to where we need to be with a more open economy, humans are allowed to interact again. We need this. This is why we live. So no, I don't believe we're going to be asking seniors to lock themselves away forever. But while we're still learning, and particularly if you're going through a vaccine process, and which takes sort of the first dose 3 or 4 weeks, second dose then 2 weeks, if you're in that that sort of phase, then yes, lock yourself away, avoid large crowds until you've completed your vaccination program. But for now, I think we're asking everyone actually to stop a lot of social interactions, just try and take the edge off this increasing transmission while we understand more about the 3 unknowns the Minister spoke about.
Professor, thank you so much for sharing your insights with us today. That was Professor Dale Fisher, a senior infectious diseases consultant at NUH.